This is a 911 call to a local private residence for a patient complaining of abdominal pain. You are a part of a 3-person BLS transport unit. All responders are EMTs. Patient is a 20-year-old female.
Okay. BSI, is my scene safe?
The scene is safe.
Alright, and is this my only patient?
Yes.
Hi, I'm Kylie. I'm with Schenectady EMS. What's your name?
Carly.
Carly, and what is the reason that you called us here today?
I have abdominal pain.
Alright. So first I will consider spinal immobilization, but I don't see any reason for us to do that. Since the patient is experiencing abdominal pain, I will request for ALS backup. Alright. So my first general impression of the patient is that she seems to be ill and in poor general impression. So Carly, if it's okay with you, I'm gonna check your respiratory rate and just like kind of assess how you're breathing. So then we'll do this. And I'm gonna put your hand over your wrist or your hand over your chest. We're gonna do this about 30 seconds. Alright, the patient appears to be breathing at a respiratory rate of 16 breaths per minute. And I'm just going to take a listen to your lung sounds, just make sure everything's going all right in there. Okay. Take a deep breath in. Deep breath in. And out. Alright, I'm going to get you on the side right over here, so deep breath in. And out. Alright, and then on your other side as well, so deep breath in. Alright, and then 2 on the front, and then we're almost done. In, and out, in, and out. Alright, patient appears to be breathing with an appropriate tidal volume and is equal bilaterally. But since given the nature of illness, we're going to administer a nasal cannula at 2 milliliters per minute. Next, I'm going to assess for circulation. And as I was taking your pulse, it was 74 beats per minute. But I'm just going to check it on both sides to make sure that we're getting... Yeah, so it is equal and strong bilaterally, so that is good. Alright. But patient's skin appears to be pale, warm, and dry. Alright. So, since due to the nature of illness, we're gonna set this patient as a high priority transport and get you over to the hospital as quick as possible. But before we do that, I'm going to ask a couple questions while ALS is on their way. About how long have you been feeling this pain?
About 2 hours ago it started while I was watching TV.
Okay. Does anything make it better or worse?
It's worse when I'm standing up or bending over, but it's better when I'm sitting.
Okay. So if you were to kind of describe this pain, how would you say that it feels?
It's kind of like cramps, but worse. It's pretty terrible pain.
Okay, and so on a scale of like 1 to 10, I know you said it was terrible, but 10 being the worst, how bad would you say it is?
I would say a 9.
9?
Mm-hmm.
Okay, and since you started feeling this pain, has it like changed over time at all?
It hasn't changed at all.
It's just been consistent?
Mm-hmm.
Okay. Do you have any allergies to any medications?
No.
Okay, are you taking any medications right now?
I'm taking a multivitamin and I'm on birth control.
Okay. do you have any past history with abdominal pain at all, or any past pertinent medical history?
Not necessarily, but I am a type 2 diabetic.
Okay. When was the last time you ate something?
2 hours ago.
All right. And before you started feeling this pain, what were you doing?
It just came on suddenly while I was watching TV.
Oh, okay. Have you felt any nausea or had any vomiting or any issues with the bathroom at all?
Mm-hmm.
No? Is it possible that you could be pregnant? Okay. Then while I'm going to take your CBG, your blood glucose level, since you're a type 2 diabetic, I just want to make sure everything's okay. And while I'm doing that, I'm going to have my partner reassess your vitals. All right. And then,
IS that.
ALS.
ALS, that's alright.
Okay. Patient is a 20-year-old female with a chief complaint of abdominal pain. She is also a type 2 diabetic. On our way to the hospital, we are going to continue with a nasal cannula at 2 milliliters per minute. We are also going to apply blankets to keep the patient warm. And while we are en route to the hospital, we will reassess for patient's vitals and go over again the primary assessment and also the secondary assessment.